and our Chinese colleagues were there, and a couple of the other doctors were there. There was a doctor who has come down with what appears to be Parkinson's disease, but it also has come down with dementia. So most likely Lewy body. But it was very sensitive and difficult to talk about the illness. Of course, he's very knowledgeable about it. And his wife was there too. And the wife noticed changes, but she told me that she has to live with him, so she can't really speak openly. So we had to be a little bit sensitive, and I think that the young doctors saw that. We tried not to. Initially, he was quite negative, remember? Because he felt surprised that there were students, and then he acquiesced, and he became very mellow, and actually got into the teaching mode, because he's a professor at Georgetown. And I think it worked out well. What do you think how it went, the Parkinson's disease and the dementia? Any feedback?
I wonder if you could talk about the difficulties of handling VIP patients, either doctor, professional colleagues, right, and other people who are prominent, and how you manage that as a physician.
Yeah, it is quite difficult, and you have to have sensitivity. Recently, we had to take care of a patient who was well known nationally, internationally, and he was a relative of the president, and we had to evaluate the patient and then recommend some treatments. I was there as a neurologist, but there were other doctors who were cardiology and gastrointestinal and renal and other specialists. My territory was relatively easy. The patient had a subdural hematoma, and it was removed, and he has done very well. And I was expecting to see the patient in 2 weeks, but the other diseases were unfortunately more complex, such as the cardiac, and the patient was anticoagulated, and he subsequently developed bleeding problems, unrelated, non-neurological. It was a GI bleed. But the whole process was somewhat stressful in the sense that this was a VIP, and I was aware that a lot of people were watching what I was doing. And so that's a problem. We had another patient a couple of years ago who was a 28-year-old princess from Saudi Arabia, and they asked me to fly there. It was overall a very, very, very pleasant experience. The Saudis, when they like you, they really go out of their way as a stranger to be nice to you. But I think this was genuine. The parents of the princess were very warm. Of course, they spoke English fluently, and the hospital was an excellent research facility in the Saudi, but again had to be careful and very conscientious in what we're doing. Actually helped push the princess for the diagnostic studies, the MRIs, which we did at night because there was activity, and I became kind of part of the team, overall team. It was very, very fascinating because every person on the team taking care of this comatose young lady was from some other country. And so at 2, 3 o'clock in the morning, after I had pushed her into the MRI facility, we had a few minutes downtime. We were all talking about our different countries where we had come from. And I was surprised that every person at 3 o'clock in the morning, including the physical therapy, the respiratory therapy, the neurologist, the cardiologist, the pulmonary doctor, the anesthesiologist, we were all from another country, and none of us were from Saudi Arabia. I thought that was kind of interesting. But generally, I think when you're dealing with patients who are well known and so forth, you have to take an extra step in terms of taking care of them, I think. It is sometimes very, very interesting how people that you would think they were special or extraordinary or whatever are really basically just human beings. Everybody is just the same, and we're all the same. Many years ago, when I was working in Boston, I had the good fortune, just luck, basically, to be the intern resident taking care of Mrs. Kennedy. And I remember I was on call in the residency. We slept in the hospital, and about 1 o'clock in the morning, I got this telephone call. In those days, we had real telephones next to the bed, and they said, Pete, better get ready. So what? I was still dreaming or something. As well, a VIP is coming. I had no idea who the VIP was. So I got dressed, put my white coat on, my pants, and I went to the emergency room, and it was Mrs. Kennedy coming in, and I was very impressed, because even while this person was very sick, she still had a wonderful sense about her. And I still remember the way she was dressed, and beautiful, not only the clothing, but bag, and wearing a shawl and so forth. And very elegant, and utmost respect for me. I was just a low person on the medical team. I was the lowest, actually, on the medical team. But I won't forget that. Very nice, personally, very nice to me. And that was an example. One time we had my mentor, Dr. Adams, he took care of many of the patients from Hollywood. And we had Katharine Hepburn. Any of you remember her? Probably not. Do you know who Katharine? The young people don't know. She was a famous movie star. Dr. Stein, do you remember her?
Of course. My age, remember everything.
The what? The what?
You remember those things. In
No,
my
but
age,
she,
those. Yeah, she was wonderful.
she had well, it was a question of whether Parkinson's disease or benign essential tremor. And I don't know if you remember her voice. The voice was kind of deep, and it had a quality to it. And Dr. Adams, she came to see Dr. Adams, and I happened to be the young intern resident. And he told me, we were in the stairwell. He liked to exercise. Dr. Adams was an avid tennis player, and he walked up and down the stairs. He never took the elevator. So I also took the stairs. we were in the stairs, and I'll never forget, he said to me, "So Peter," he had a deep voice, "one day you can tell your grandchildren that you took care of Katharine Hepburn." I said, "Thank you, sir." But you're talking about VIPs and nice people. I think the bottom line is that my experience has been very positive. Everybody is a human being, just like you and I, and I've never had really a bad experience with them. So if you have an opportunity to take care of people, and one of the hallmarks, and something that I've told others, is that in our office here in the Washington, we're very close to the White House, and on any one day, I think this represents America, because any one day I can have in the waiting room an unemployed person who is basically homeless, unemployed individual sitting in the waiting room next to somebody from the White House. And to me, kind of as a amateur philosopher, I look at the room and I'm saying, this is America, where everybody can be at the same place. And I like that. In other words, our offices, and ever since I've been involved, we do not specifically choose a patient based on either their income or their position in life. And I think I would like to recommend that for everybody. And it's really amazing to see that. And I think this is something that can happen in many countries, but certainly in America, where everybody has equal opportunity. The opportunity is there for everybody. And some people take part in that opportunity and some don't. But there's no, as a doctor, I don't criticize that. Everybody is a human being. And so we try to take care of everyone. But I'm looking at the list today. We have somebody here who's, let's see, Larry, yeah. We have somebody here who's a television star. And some of the younger doctors will recognize him. Because when he comes into the office, everybody wants his autograph. And he's really a very interesting fellow, very charming. He's one of those rappers. Dr. Stein, did you see him?
Is that
The rapper?
Yeah. The man on television. Yeah.
He's on the television on, I think, on The Voice or something.
Right.
I don't watch that, but anyways, be on the lookout today, because usually the other patients, they want his autograph when he comes into the waiting room. And my secretaries get all excited, But anyway, so we will have an interesting VIP today. Any questions, Dr. Stein? Have we had any interesting questions? Well, we also have. Oh, that's a telehealth. So we're going to have a few patients with telehealth too, and dizziness, seizures, epilepsy, head injury, that kind of stuff today.
Okay.
Now, this Saturday, Dr. Stein, are we meeting our colleagues, our Chinese colleagues? Is there a program?
That's up to Dr. Naka. I'm usually not on a Saturday.
Okay. Because usually we have more time on Saturdays, more time to ask questions and discuss things.
Dr. Bernard, I was just hoping to ask you a question, if that's all right.
Yes.
I just wanted to know your opinion on cannabis and cannabis, CBD-based products
cannabis
for headaches and, multiple sclerosis and general neurological conditions. Do you regularly prescribe those for your patients? And is it
No, I have to say that I don't have a lot of experience with cannabis. It is available. I yesterday we had a patient with seizures and behavioral problems, and he was on CBD oil, and so I don't actually prescribe cannabis THC. We do have synthetic forms that we have used in the past for attention deficit disorder, but I really don't have enough experience to give you an informed view. It's starting to be used in epilepsy and seizures in some cases.
Yeah.
And my own view is that it may be helpful. I think it should be tried. It's certainly not as bad as, let's say, narcotics or alcohol or some of the others. So my own philosophy is that we should get some experience with it and maybe do some kind of prospective double-blind studies. But it makes people feel better, and it's not really, I don't see it as dangerous. There are some issues about that it's a gateway. It's called gateway drug, that somebody starts on with marijuana, but then they go to other drugs. I'm not sure that that's true. Dr. Stein, what's your experience with cannabis?
Dr. Davinsky has done a pretty credible job using it for Dravet syndrome and other.
In NYU.
Yeah, he's done a lot of publication on that. Personally, I've only I've only used marijuana 3 times in my life in medical school, and it drove me crazy. So I don't use marijuana. But a lot of patients come in, and you know, if you listen to patients, a lot of patients say it's helpful for them, but they know more than I do. Now, I'm really a bystander in this situation. I have to appreciate that patients find it helpful in some cases, but I don't know. I'm really not. It's not my area of expertise. But it's hard to tell a patient who says it's been helpful to not use it when I see no side effects.
My own philosophy is that if a drug is not harmful and somebody is using it, I'm all right with that. I'm thinking about the placebo effect. It's 30%, 35%, maybe more in some people. And if somebody derives some pleasure out of that, I'm all right with it. I don't have any kind of moral statement. If it's working and a person is helpful and it's legal, so they're not going to get in trouble with the law, I think that it should be tried. And many medicines that we use have horrible side effects. So and many medicines that we are using have a cyclical aspect to them. They're used and then they lose favor and then they come back again years later. So
many medicines we use are all plant-based. Foxglove, you know, Chicona bark.
Dr. Acevedo,
yes, Dr. Bernad. So I was really curious to hear your thoughts on what are going to be the biggest challenges and evolutions in neurology in the next 10 years. I know that there's so much happening. There's silencing therapies, gene therapy, transcranial stimulation, monoclonal antibodies. What are your thoughts on what's going to happen next?
well, I think that we are in a very exciting time, and there's been an explosion in terms of therapeutics. And sometimes I lament that because, for example, in epilepsy, we have over 30 different anti-epileptic drugs. And to try to keep and be very knowledgeable about each one is virtually impossible. 30 years ago, when we had, let's say, 4 or 5 anti-epileptic drugs, we were experts in every medication, how to use it, how high should you go, the metabolism, and so forth and so forth. In today's world, it's extremely difficult.
Mm-hmm.
And almost every day we have the different drugs being promoted in America. We have these salespeople, and they're pushing their medicines, and they're just doing their job. I understand that. So I usually ask some kind of medical questions, and they have a hard time answering. They'll go away and they'll research it, or they'll have somebody in their neuroscience to bring back the answers. But I think in most of the big diseases, such as degenerative disease, there turns out to be a lot of protein, a lot of infections, and the treatments in, for example, multiple sclerosis, where we're still not at a point where we can really change things. Although the monoclonals seem to be extremely helpful.
Mm-hmm.
So I see that as a growth. And then artificial intelligence. I think the time is coming where it's going to be a patient and a machine with all of the symptoms going in, the physical exam even by a machine, and then the 3 or 4 diagnoses. I think that like all older doctors, we're going to be losing something and we're going to be gaining something. I'm amused because when I was at Queen Square, the London University, UCL, I remember sitting in the audience, and the old neurologists, let's say the older neurologists at that time, they had to be a wonderful showman, and they would be in front of a group, let's say 20, 30 UCL. And there was a patient, and they would give the history, and they would do the exam, and there were basically no radiological studies. Let's say there was no CAT scan yet, no MRIs, no even angiogram. We used to do the angiogram direct, stick to the carotid. So the professor was able to, using anatomy, neuroanatomy, neurophysiology, neurochemistry, localize. We used to say to localize the lesion exactly where in the central nervous system or peripheral nervous system. And then they would say that this is what the disease is. It's a small tumor in the midbrain, and so forth, and we have no treatment, et cetera, and then the patient would be rolled out, and all of the residents and the registrars and the professor would clap, and the professor would go home. And it turns out that it was really a multiple sclerosis case. It wasn't anything to do with a tumor or anything. So, nobody would know that because the program was over. And I'm thinking of that. And then in 1973, I saw the first CAT scan, and that changed the ball game. The CAT scan, the first CT scan. I was sitting in the MNI, Montreal Neurological Institute, and it was a patient with Parkinson's disease, and the professor was Francis McNaughton, Dr. McNaughton, and we had the whole day was on Parkinson's disease, vertical integration, neuroanatomy, neurophysiology, neurochemistry with Ted Serkis, and it's just unbelievable teaching program. And then finally, to see the patient, I was a second-year medical student, but you know how it is when we haven't seen patients yet. And there was a patient right there in the amphitheater, and all the features of Parkinson's disease. And then we saw the CAT scan of this patient. It's just unbelievable. And that's when I decided to be a neurologist, actually. So the advent of the CAT scan really helped me to decide about the future. I liked all of the fields in medicine. I was like a typical medical student. I liked everything. You know, anesthesiology, yeah, I want to be anesthesiologist. Urology, I want to be urologist. Obstetrics, gynecology, oh, it's beautiful, the baby. But then when you saw neurology and you saw the anatomy and you understood the chemistry, the breakthrough in Parkinson's disease at the time with L-DOPA, it was unbelievable. And so I think that's what's happening in medicine. There's constantly these breakthroughs. And I expect almost every year there's going to be some kind of excitement. The CAT scan Nobel Prize, you know, this is the kind of, I think the next horizon is artificial intelligence. AI is really extremely helpful. And more will be done by non-physicians, I think, in terms of seeing a patient and making the right diagnoses and then the treatment. And in a way, I lament losing some of our skills to the machine, to the AI. But I think this is just normal evolution. Yes, go ahead. Yeah. I can't hear you. This is Dr. Shaw from Pittsburgh. Can you speak up?
Yeah.
I can't.
Can you hear me now?
Yes, I can.
Okay. So just on this topic, recently Elon Musk has developed a Neuralink, which a chip he's going to implant in the brain. So just on that topic, like even non-physicians are looking towards it and using the AI to kind of diagnose or even treat certain diseases.
I think Dr. Shaw is absolutely right. And as we lose our control as physicians about medical issues, we lose them to innovators, we lose them to engineers, we lose them to everybody else. There's going to be more input from non-physicians. I think it's very important for us as doctors to maintain some control to help our patients.
Right.
Otherwise, we will be pushed to the side. We will be pushed away. We can see that, Dr. Stein, by the insurance companies. Right. They don't respect us, doctors, anymore. 30 years ago, the insurance company would come to my office, would sit down, and would negotiate a price. Today, I don't even know who they are. They don't call me. They're not involved with me at all. And they pay us what they think is right. So as physicians, we have been pushed aside. And in the last few years, it's accelerated. We are in many ways being replaced by secondary, the nurses, physician extenders, and so forth. Yes, go ahead, Dr. Acevedo.
So, Dr. Bernad, I actually studied engineering before enrolling in medical school. And
Yep.
I feel that's an MD can really have a different perspective and really understand what's relevant to the patient. And that's something that as an engineer, I didn't have. And I recognize that now I understand what's really important for the patient. And I think that physicians will always have a role in leading and deciding things for each patient and for the patients as a whole.
Yes, that's very true. And what you've noticed is with the coronavirus situation, we are now doing teleneurology. For example, our office is full of computers and we're doing teleneurology. And actually, I can take care of many patients on a computer. I can take the history, I can do some examination, and it does work. It does work. So that there's some realism in terms of advancing the technology and basically marrying the clinical with the technology.
I see that as a positive,
Mhm.
and we should continue to explore that.
Mhm.
I think what I see is two things. I see two things happening because you asked me the broad question initially. I see the technical aspects of medicine exploding in every element, every part of medicine. I would say if you draw a graph, it's going exponentially. So the technical, scientific, artificial intelligence, mechanical, all of those are exploding. On the other hand, the second aspect of civilization and society, which is more of the moral and the ethical and the human qualities, they are not increasing. They are more or less steady and flat. So you have these two processes, the instrumental, let's use the word instrumental process, which is going up like a rocket ship. Musk, for example, going up like a rocket ship. And then you have the human part, the human element, the institutional, let's use that word, the institutional processes really being flat. And I think these two processes should be parallel. In an ideal world, you should have these two processes moving about the same rate, but we're not seeing it. The primitive aspect of human beings, the human nature that we doctors understand, has remained kind of flat, horrible. And you see that in the United States with the riots and people killing each other, and the worst element of human being in the United States in almost every city. Whereas the informational age and so forth is instantaneous. With the cell phone, you know exactly who is where. You can call people in, come over here, let's do a riot over here, let's do a riot over there, etc. So the two processes have to become closer, or else it's going to be chaos. But from a medical point of view, we need both. We need both to work together. And that's really the secret of how to do that, how to bring the two processes together to work side by side. What do you think, Dr. Stein? That's a good question, by the way, that you asked. Yeah.
What do I think? I think we have to be aware of the motivations that cause people to have these inappropriate riots. Don't make any sense. Protest does make sense. And it's I think our job as physicians with psychological expertise is to understand the motives of people complaining about their situation in life. Obviously, rioting is terrible, but there are currents in society that have to be addressed. You are a rare person. You take care of everybody without any qualification. You don't care where they come from.
Well,
you're the last person in the world to be has any racial bias in the way you take care of patients, and you're great that way. But society is not that way. Black people are very lucky to have you as a doctor. I've never seen a case where you treat them any differently.
But I think this is the teaching of Hippocrates. This was the teaching of our ancestors, and I try to follow the forefathers in medicine of what they felt was important. Every human being is important, every sentient being.
Right.
I even feel that that flies are important. The other day I was eating dinner and this this fly came in, and instead of killing the fly, I opened the door and I tried to push the fly out. Took me 15 minutes, but I did it, and I felt better. I felt better. As a neurologist, I realized that a fly has a nervous system. In fact, many of my colleagues study the fly for Parkinson's disease, Alzheimer's disease, ALS, motor neuron disease. It has a nervous system. And as a doctor, I don't want to destroy that nervous system. So it may sound strange, but I kind of pushed the fly out. Anyways, I really believe in killing anything that's sentient. Yes.
Dr. Bernad, I agree with everything you said. That's in an age with such knowledge, wisdom is worth more and more. Knowing how to be humane and how to react in different situations with all that knowledge is really important.
Thank you for that. Since I became a neurologist, I have become more sensitized, more sensitive about the nervous system, especially. And so I don't feel that I have the right to take or destroy the nervous system, even a small object like a fly. So certainly not human beings. And I think all physicians, we are obligated to take care of everybody without ability to pay, because our forefathers and foremothers, let's say, our previous doctors who came before us, I think also believed in this belief system of taking care of everybody, not based on their ability to pay or their ability to be important to you or anything else. I think the humanness, the humanity is so critical for doctors. We are in a very special situation, honorable situation, to take care of human beings, fellow human beings. And that's how I look at it. One of the examples is a very famous doctor called Maimonides. Moses ben Maimonides was the physician for 500 years. There was the greatest physician, and his writings, he wrote profusely. Many of his writings are in existence in Cambridge University in England, but he was a physician born in Spain, in Cordoba, and he and his family they were expelled. They were running around the Mediterranean in different countries. Finally, he landed in Egypt and became the most famous doctor for his time. This was in the 13th century, and he was the doctor for Saladin. Saladin was in charge of all of the Muslim peoples, but Saladin, very intelligent man, he welcomed minorities, and Maimonides was one of these people who was he was the physician for the court. And when he finished in the afternoon or at night, he went home with his donkey. I think he had a donkey. He had to go home because regular patients were waiting, people who were poor, who had no money. They were waiting around his house, around the building. He worked till 2 o'clock in the morning to take care of them. And then in 6 o'clock, he had to go to Saladin. That is an example for all of us, that you take care of everybody. And I remember my teachers telling me, if you take care of all the people, some rich people will have enough money to pay you, so you can cover those who don't have any money, who are poor. I take that philosophy to heart. And that's how I've been. Some people can pay us and some people can't pay us. But you got to take care of everybody. What do you think, Dr.?
His other name is also Moshe ben Maimon, or commonly known as Harambam.
Yeah, but there have been many wonderful physicians from Hippocrates' time all the way up to now that have done the same. Always recognize the humanity in your patients. And if you recognize the humanity, it becomes wonderful to help somebody. Anyways,
Thank you.
I think we have a patient here. Let me see. Let me check. I think the first patient has come. So,
Thank you very much.